Hi there. Well, today I'm talking about phalloplasty. I am 7 weeks post-op as of this past Monday, and I thought I would make a video to talk about my experience because I know when I was in the lead up to surgery, I was scouring every social media for any bit of information and content about bottom surgery and phalloplasty specifically that I could find. And when it came to YouTube, it feels like there's not as much content on YouTube as compared to maybe some of the other social medias out there. And that what content does exist is either a bit old, um, a different country like Finn posting his experiences was super helpful to me, but he also is in the UK and they do things much differently than the team that I ended up going to does. Um, and then there's just not as much of a diversity, I feel like, of people talking about their experiences on YouTube. So I want to contribute. Like I said, I'm 7 weeks post-op. I went to Dr. Chen in San Francisco. He is a wonderful surgeon, and he does not work alone. The Bunkie Clinic surgeons, Dr. Watt and Dr. Safa, were part of my surgical team. They are the microsurgeons who actually create the penis, do the glandsplasty, do the nerve and arterial hookups. And then Dr. Chen is the urologist who does the urethral lengthening, the vaginectomy, the scrotoplasty, and any testicular and erectile implants. So I have only had stage 1 so far. And honestly, this surgery, not that bad in my experience. I know there's a lot of people who've had a harder time than I do, and part of the reason that I want to make this video is there is a tendency for people who are posting online, and not just about this surgery or surgery in general, this goes, I think, for most things, the people who are posting are the people who are having problems and they have something to say. And the people who are not having problems are not posting so much because they feel like maybe it's a boring update or they don't have as much to say, or because they're not having problems, they're not seeking advice or comfort from community. And so they're not posting their experiences that were good or easy or boring. But I think that then skews the perspective of people who are researching in this surgery, whether for themselves or just to educate themselves about it, or even because they're transphobic and they're trying to find bad information, they're trying to find shit to talk about. And so while it's important for people who had complications or issues to, educate people who are going into the surgery about the possibilities, I do think that I don't want to say that there's too many people talking about these things, because it is important, but there's not a balance, and there needs to be a balance. Yeah, so I had RFF phalloplasty. I used my forearm, and I had my T-dick buried. I had nerve hookup done. I had my vaginectomy done, and I had urethral lengthening done. I was supposed to also have scrotoplasty done on the first stage. That's typically how Dr. Chen in the Bunkie Clinic does phalloplasty, unless you choose to opt out of one of those things. I'm choosing to get everything done, but I'm fat. I have like a 35 BMI. I'm 5'1". I weigh around 185 or so, and so Dr. Chen had to do a slight monsplasty. I don't have any additional scarring from doing that. So I'm guessing he did it. If you are familiar with periareolar top surgery, where they cut a circle and then kind of drawstring it together so it's smaller, I'm guessing that's how he did it around the base of my penis to do a mild monsplasty versus when they do a large mons resection and say this is your pubic mound and then they do an incision up here to kind of like pull everything up and out. That did not happen for me, but he did have to do a monsplasty to help reduce the fat in the area because I am larger. And because he had to do that, and because I have dense forearm fat, which for me, I think is resulting in everything I could want in my penis. It did make it a little harder to close everything up, and then the monsplasty, and so they were concerned about blood supply to the labia, which is what gets turned into the scrotum. And Dr. Chen is a more cautious, conservative surgeon, which is something I appreciate about him. So he did not do scrotoplasty, and we will have to wait for me to finish healing from stage 1, and then in stage 2, he will be able to do the scrotoplasty. That does put me a little bit behind on like what I was hoping to get done. My plan originally had been to get everything typically done in stage 1, and then in stage 2 is typically, if everything goes perfectly, glandsplasty to create the circumcised head looking, like circumcised looking head of the penis, and testicular implants. For me, it will now be glandsplasty and scrotoplasty. Originally, I was just gonna do those 2 surgeries, get it done this year, and then leave it at that for a while and just heal and see how I feel. I didn't want to go through 3 surgeries in quick succession. The 3rd surgery being the erectile implant. I wanted to give it some time and see how I felt about things without an implant. But having balls is very important to me, and then it also does have a functional purpose, of like kind of making sure everything's pushed more forward, and so for me having balls is important. So that means that regardless of whether I want the erectile device or not, I need to have 3 surgeries to get everything that I want done. So since I'm going in for 3 surgeries anyway, I will get the erectile device, still debating which one, done during that 3rd surgery since I'm gonna be there anyway. Yeah, so that was the only thing that didn't quite go to plan in surgery. Penis-wise, I am so happy. It is the exact size, like exactly the length and girth that I had been hoping for. I also was very realistic about what my body would probably be capable of providing, given, the graft site I'd chosen, and what would be reasonably sized, in my opinion, for my body, like for how tall I am. Mad respect to the people who are getting 6+ inches and that's what they want and they're happy with it and they're able to manage it in day-to-day life just fine. I could not do that. For me, I think 5 inches would be like the max amount that I could handle in day-to-day life, and that would be pushing it. I'll be very candid. I wanted somewhere between 4 to 4.5 inches. That's what I asked for. I got exactly in between that. It's the past couple of times I've measured 4.25 inches, like on the dot. There is a tendency as you heal, like over this first year, for gravity to have an effect and for your penis to gain a little bit of length. It kind of depends on your personal skin elasticity. My skin is not very elastic, and like I said, my fat, like all over my body and including my forearms, is quite dense. So I don't expect to gain much length, which is great. I don't want to. This is already like, wow, I can't believe just over 4 inches feels like this big. So I'm hoping to land around 4.5 inches and keep it at that. I really don't want any more than that. I think it's a lot. It's a lot to, have more. That you got to figure out where to put shit, um, and then my girth will fluctuate more than I think my length will, because I am only 7 weeks post-op, and swelling takes about 3 to 6 months to fully go away. I also am keeping in mind, though, that for me personally, whenever I have a surgery, I don't really get swollen, and if I do get swollen, it's definitely on the lesser side. Like, I don't swell that much, and the swelling tends to go quite quickly. So I just measured a few days ago. My girth was like 5.4 inches around. So I'm gonna guess that, and I think most of the swelling has gone, but I can tell not all of it, is gone, because I am early in. But I think I'm gonna land around 5 inches around, like probably at the lowest end, maybe a little bit more than that. Like, I don't think I'm gonna lose that much more girth from swelling reduction, which makes me very happy, because like I said, that is pretty much exactly what I wanted. Yeah, I'm happy. I have had no complications with my urethral lengthening. I got my catheter out on a regular schedule. I've been pissing just fine. It's great. It's, a learning curve, but and also, as swelling reduces, uh, when you're more swollen, your stream is a little funky, because of the extra pressure and all of that. But as swelling goes down, my stream is getting a little bit more consistent and predictable, and also I'm getting used to peeing standing up. So yeah, that's been great. I know the vaginectomy site has a tendency to give people problems, as far as it's a very common area for there to be wound separation and for drainage and such. I'm very thankful that I've had zero problems with my vaginectomy site. I had very minimal drainage really early in surgery, or really early in recovery, and like it's not been a problem at all. It was the most painful part of the process. And I think that's another thing I want to say, is some people experience a lot of pain with this surgery. And again, they tend to be the loudest voices. Personally, I had little to no pain for almost all, in hospital, and for the first couple of weeks. I had maybe a 0 to 3 out of a 10, on the pain scale. Very easy to manage. Most of the time I had no pain, and there was only a couple of very specific moments, like the day after surgery, the first time that they rolled me side to side to change out the bedding under me. That was super painful. It was over very quickly. And after a couple of days in the hospital where you're just lying in bed and you're not allowed to get up, I looked forward to getting rolled once per day, because it meant I got to fucking move, and I just wanted to move. But the first 1 or 2 times were painful. Probably spiked to a 5 or a 6 on the pain scale. The day 5 post-op, which was discharge day for me, where they took the wound vac off of my arm. The actual part covering the graft could not feel, but the adhesive that was around, I have arm hair, and taking adhesive off of arm hair hurts. That hurt. And then there was 1 or 2 times where my split thickness graft site, on my thigh, was touching some of the bedding underneath, or a pillow or something, and for too long and got kind of adhered to it, and then pulling that, removing that, hurt. So it was just like a couple of moments of like sharper pain, but overall, little to no pain. Very easy to manage. Um, I also was pretty mobile and pretty independent early on. I got discharged on day 5. Um, I will say on day 4 is when you get to actually get out of bed for the first time. A very simple, like, getting up, standing up, turning around, sitting down. No walking actually involved, but just to like get you sitting upright and to get you out of bed. Um, the first time that we attempted that on day 4 went really poorly, because you're reclined, right? For It's been 4 days, 5 days, because they don't count surgery day. That's day 0. Of not standing up, and so I had like my blood pressure dropped, and I almost passed out. I did not. I breathed through it, but it was very scary. I was very close to passing out, and they got me back in the bed immediately and inverted me and like got my blood pressure level again. And we waited until like late evening to try again, and my second attempt went perfectly fine. Um, it was hard emotionally though for the rest of the day to like have struggled with that, to have that have happened. But then at the end of the day, I got to try again, and it went perfectly, and I got to sit in the chair for like 20 minutes or so, just hanging out, and I felt so good. It felt so good to do that. Um, just like not only physically, but just like emotionally, to be like, oh, thank God. And then the next day, on day 5, before they discharge you, they have you walk around a little bit. Did that perfectly fine. Yeah, I think I lost the train of thought somewhere, so let me just keep going. I think I was talking about pain, and how I had basically none. The Yeah, the vaginectomy site was the most annoying part. And even then, it wasn't really painful. It was just kind of sore, and I had to be careful about like how I sat, basically, to try to avoid putting direct pressure on it. And I will say that while it is a little annoying and frustrating that I didn't get scrotoplasty in stage 1, and that does kind of extend my timeline of surgeries, I think that the lack of issues I've had with vaginectomy might partially be because I did not have scrotoplasty. Behind the scrotum, like if they do it in stage 1, is another really, really common area of wound separation and issues that people tend to have. Um, and I think that because I still have my labia, um, that was one less wound for me and my body to heal, and it covers and protects and offers a little bit of cushion, between my vaginectomy site and like where I'm sitting. Um, I genuinely think that that played a big role in having my vaginectomy heal so effortlessly. Like I didn't really ever have to think about it, other than in going poop and just trying to be careful about not pushing, when I was like early in healing. So I don't know, maybe there's something to staging things that way, even if it wasn't intentional. Like I think that might be beneficial. I don't know, I'm no doctor. um yeah, what else? My arm healed wonderfully. I did not experience any graft loss or rejection on my arm. um the only issue I had on my arm per se is this spot right here in the crease took a long time to heal, and it is kind of like widened in that area, which makes sense. I didn't baby my arm or my hand, and I still am not. I was using it, and so therefore I was getting a lot of this action, and therefore it took longer to heal there. I do only have just like this one little scabby area right here that I'm just waiting to heal. I don't know why that is taking so long. Like, you're not doing anything. But that's like the last little bit that I'm waiting to fully 100% close up on my arm. My thigh, I think I might have lost a little bit of patience. I'm really bad about itchiness, bad at self-control about itchiness, being itchy. So I might have peeled off the scabbing zero form coverage that was on my thigh a little bit too early. I just couldn't take it anymore. I wanted it off. I think I took it off week 3. It was like right before. I think I took it off like the day of my second post-op. So I was like 2.5 weeks post-op when I finished removing the last of it. But like over a couple days, I'd been slowly removing and cutting away parts of it, and then I took the last part off on the day of my second post-op. I honestly probably should have waited a little bit, because after a few days, I noticed and realized that there were like several small raw spots on my thigh that were clearly not fully healed, which then became scabby and very itchy, and I am bad, and I was scratching and peeling at my scabs, and so it's been taking a long time for those little spots on my thigh to finish healing. It's almost done. I have like 2, I think, small spots that are almost done healing, and then that'll be completely good, but it is very red. I'll show you guys that in a minute, I think. So yeah, just be patient. Be patient and don't scratch, don't itch, don't do it. It delays healing. I knew that, and I did it anyway, but it's fine. And then for my penis, I think the only complication, I know it technically will go under their complication statistics. You can barely call it a complication, really. Right out of surgery, like within a day or two probably, I had blisters kind of going along the seam of my penis, like on the underside of the shaft, and most of those healed on their own, no problem. Like, that's not what the complication was. They were pink and healthy, go away on their own. But at the very bottom, like at the base of my penis where the seam meets my groin, like at the base of my penis, there was a blister that did not turn pink and heal on its, well, it did heal on its own, but it turned black, it turned necrotic. But it was a small spot, I would say, maybe around the size of my thumb, like a little, yeah, about that big. And then around the edges, it kind of turned pink and like healed, but there remained like a spot that was black and necrotic. And so I had to let that heal. I think at my second or third post-op, Dr. Chen was like, well, sometimes the scabbing on wounds, it actually impairs, like will slow down healing. It kind of like is blocking the way. So he, very scary, took tweezers and scissors and like kind of lifted it up and cut it off. I couldn't feel it, but it was quite scary to have scissors at my dick. But he knows what he's doing, and he was correct. He cut that off, and I had a little bit of mishap of trying to like understand what was technically wet and what was dry as far as wounds go, because that determines how you approach wound care. A wet wound needs to be kept dry, so you just like put gauze and change it out regularly. A dry wound is when You go to change that gauze and it's sticking to the wound. That means it's dry. Whether it looks wet or not, I learned, if it is sticking, that is dry, and it's time to put ointment. Um, I was having an issue for a couple of days that led to some fresh bleeding of me not understanding that. And like every time I'd go to change the gauze, basically, I was ripping open the wound that I was trying to heal because it was sticking. So I fixed this by doing not just dry gauze, but a coat of Aquaphor on the gauze, and then a little bit of Meta Honey on top of that, and then putting that onto the wound. Miracle. It like sped up the healing so fast once I started doing that thin layer of Aquaphor and that dot of Meta Honey onto the gauze and putting that onto the wound separation. It was also a very shallow wound separation / necrosis. Like once he cut it off and got a look at the wound proper, he was like, oh yeah, super shallow, shouldn't affect your urethra at all. I had like a week from him doing that to when I was gonna do voiding trials to see how my piston was gonna go, and if I was gonna get the catheter out on time. And sure enough, I had no problems. It was shallow. The wound separation was shallow. Did not affect my urethra at all. Did not affect my healing timeline at all. Really, it was just I was never concerned about it. It was never painful. I never had any infections anywhere, and it was just one more spot to do some wound care on. Really easy, not scary. I couldn't even really see it because it was on the underside of my dick. I had to like use a mirror or take pictures to like even see what was going on down there. Easy peasy. It is basically like a dot at this point that I'm just waiting to finish completely, healing over as scar tissue. And that's fine by me because technically my surgeon's post-op instructions say no earlier than 8 weeks before you can like submerge yourself in water. So like taking a bath or going swimming, maybe longer if you still have open wounds. So by that 8-week mark, which will be this upcoming Monday, I am 100% sure that that tiny little dot, like I think in the next couple of days, that's gonna finish healing. So I'll be good to go there. And then this tiny little scabby area also I think will be done by 8 weeks. So I think I'm pretty right on schedule as far as healing goes. Yeah, I think that's it. As far as the hospital stay and the surgeons go, I mean, Dr. Chen and Dr. Watt are so personable and kind, and like they know what they're doing. You just gotta trust them. They've done, Dr. Watt said, I think around 600 of these surgeries. That's a lot. They know what they're doing. They've never had a total loss. Like no one that they've worked on has ever lost their penis. And I think he said that there's been like 4 or 5 people total out of that 600 or so that needed to go back into the OR for emergency surgery shortly post-op. And they fixed whatever, that emergency was. So it just, they're a great team. I waited a very long time to go see them for a reason. Highly recommend. Yeah, I'm also very lucky, just in general, to be living in the same state as them. Yeah. What else? The hospital stay was fine. Boring. Like day 3 and 4, I was getting very antsy and grouchy and just like not feeling good because I wanted out. I wanted out and I wanted to move, and I was sick of being in bed. I was walking pretty frequently once I got out of the hospital. pretty independent, especially after my first post-op appointment. That's when they take away the catheter bag. That when you're out of once you're out of the hospital, between then and your first post-op, you have a catheter bag. I had a smaller leg bag, so I could be mobile during the day, and then we would switch it out for the larger one that kind of tethers you for at night. And it was fine, and it was nice to have the leg bag to be able to like be mobile during the day, but it was very annoying to have a catheter bag. And switching from that to the flip flow valve was really big in me being able to be a little bit more independent. At no point did I need help going to the bathroom. The only thing I needed help with early on with bathroom stuff was just like getting my pants and underwear back up. But like, I know some people are like, oh, you're gonna need help wiping. You're me and my girlfriend were ready for her to have to wipe my butt, but thankfully did not need that. I used my non-dominant hand for my graft, and so I was fully able to take care of myself. It also helped that the place that I was recovering in, that we were staying at, between getting out of the hospital but before going back home, fitted with a bidet, and then I made sure to buy a bidet for my personal bathroom at home, and that helps. That helped a lot. Highly recommend. Other forms of independence, I mean, I was able to get in and out of bed and in and out of chairs by myself. I didn't need help with that. It was not too bad. Healing, recovering, the surgery itself, like all of it, not too bad. There were, moments of like post-op depression for sure, that I didn't realize was post-op depression, until like a little later, because for me it didn't manifest in like crying or sadness so much as it manifested as like being grouchy, not being social, like just not wanting to text people back who were like checking in on me, not wanting to do anything, just like being bored and in a bad mood, essentially. But that got better with every post-op appointment, because every appointment, something changed. The first one, they take the catheter bag off, and you have the flip flow valve to help retrain your bladder to hold urine. The second post-op appointment, I believe, is when they said I could stop wearing the cast 24/7. I think it was the second post-op appointment. I'm not even that far in recovery, and like those early days are already a blur, maybe it was the third one. And then the fourth one, the last in-person post-op appointment, was huge, because that was like, you don't need to wear the cast at all anymore. Your arm is pretty healed. That's when I was told I could start lying on my side again, which was huge, because around week 3 or 4 is when the back pain started really setting in. I had managed to avoid it for those first like 3 weeks, but after 3 weeks, my back was starting to hurt pretty fucking bad. But I think that was probably one of the worst parts, was the back pain. But having a wedge pillow, a nice firm wedge pillow that I then also padded with like regular pillows, I think is what helped me avoid back pain for as long as I did. So highly recommend getting a wedge pillow. But yeah, so the last post-op appointment, I was 4.5 weeks post-op, is the fourth one. Lie on your side, arm is healed, you don't need to bandage it or have the cast on at all anymore. I was given the clear to stop propping my dick, which was huge for my ability to go out into the public and like get out and do shit. Not having to like constantly be worrying about looking inappropriate with a huge bulge in my pants and trying to hide it. And that is when the suprapubic catheter got removed, um, and I was given the all clear to just piss through my dick all the time. And it was just that was the biggest turning point, was that last post-op appointment and getting cleared for all that stuff. Huge turnaround in how I was feeling, because I was getting tired of having a catheter. That last week of the catheter, I had avoided like any painful bladder spasms, but that last week I was starting to have more painful bladder spasms and like needing to take those meds to manage that pain more frequently. And I will also say that don't just like don't drink carbonated beverages when you have a catheter. I didn't realize, but even the smallest amount, it doesn't even have to be soda, like any carbonated beverage. Like I was trying to drink kombucha for my gut health, and that was triggering bladder spasms and like painful bladder spasms. Because before, I did have some bladder spasms, but it was not anything painful. It was just the kind where you're like aware of the catheter in your body, which is uncomfortable and weird, but not painful. But having carbonated beverages and also having the catheter in my body for, that long at that point was starting to become painful. The meds do help though. Take the oxybutynin. Take it. Um, yeah, I think I think that's everything. If anyone has any questions, let me know. I am more than happy to answer questions. It is basically one of my life goals to educate, the community specifically. I don't really care if you're not in the community. That sounds bad, but like it is my goal to educate trans men and trans masculine people and anyone who's interested in having phalloplasty about this surgery, because there is so much misinformation out there. Um, and I think that more there is a real barrier of entry as far as like wait times and all the things you have to do to prep, and just like, you know, how long you have to be out of work, and like for certain people, depending on where you live, like travel and the expenses, like that's all real barrier to entry. And it is super understandable why people don't get this surgery because of those things. But I also think that more people would pursue this surgery if they understood how customizable this surgery is, what is possible, um, what it means to have complications. I think people hear complications and immediately jump to, oh, the surgery failed. Oh, it's something painful or something super bad or complicated or difficult. They don't realize the complications can mean something from like what I had, which was a shallow bit of wound separation that was easy to heal and had no real effect on my healing timeline, to something like a fistula, which also is not a huge is a real annoyance and hindrance to someone's healing, that may be emotionally frustrating. And for some people, it's not the end of the world. It's something that often will heal on its own, and then sometimes a fistula will need surgical intervention to fix, and it is a minor surgery. And there's a couple of options to tackle a fistula if it needs surgical intervention, but it is not the end of the world. And sometimes I'm not out of the clear. Strictures are also a real complication that comes up. Fistulas and strictures are the two main things outside of wound separation that are like, when you hear about complications, it's one of those three things mainly that people are talking about. And strictures usually don't set in until like 7 weeks onwards for, well, I think like the first 6 months or so is like 7 weeks to 6 months or so is like the main part of time that of healing where a stricture may come up. A stricture is usually from an excess of scar tissue. Sometimes it can be from other things, like if you were really hairy with a lot of thick dark hair and you failed to like permanently get rid of that thick dark hair and it grows in your urethra, that can cause a stricture too. It can become a blockage, which is why it's so important that you get hair removal done permanently with electrolysis and not laser, which cannot legally call itself permanent hair removal because it is not guaranteed to be permanent. Please, if you want to do laser on the outside of your arm where it's aesthetic, go for it. You'll probably have to do it again and again over the years. Like I said, it's not permanent. But for the love of God, just do the more annoying long thing that takes a longer time but is actually permanent and get electrolysis on your urethral lengthening. Otherwise, you may just have urethral complications that are now very complicated to fix. Anyways, hair, that can also cause a stricture, which is a blockage that causes you to have a weaker, narrowed stream when you are trying to pee. And in more extreme cases, this is usually more on the side of like granulation or scar tissue, may block your urethra altogether. A stricture always needs intervention. It may not necessarily have to be surgical. If it's a small stricture, they might be able to fix it with dilation or there's another thing, I think like no, I can't think of it. There's another way that's non-surgical that they can fix a minor stricture. But major ones, and especially ones that are fully blocking you from peeing, that is an emergency room visit, and that is a surgical fix, and that is one of the more scary things. But again, it is something that can be fixed and is not the end of the world. Just get it taken care of, and it does not mean that your urethral lengthening has failed or that your phalloplasty has failed. It just means that you need another step to fix things. Usually these things, strictures and fistulas, if they need surgical intervention, it's like a one and done, and usually they're good. There are cases, and you will see people online talking about these cases that they, of their personal experiences, that are worse and take a long time to repair and take multiple attempts to repair. That is a real possibility, but it is the minority. Despite what you might see online, like I said at the beginning of this video, people who have problems are the ones who are posting. The people who are not having problems are not really posting, and that is an issue, and it skews perspectives. So I just needed to put it out there. The most of the time, you will not have these issues. If you do have these issues, they will be easy fixes, or they might even fix themselves with no intervention. And if you do need intervention, it will usually be a one and done thing, and then you will be good to go. Just got to put it out there, you know. It is a major surgery. It does take a lot, but it is important to have a balanced view and to understand that there are so many people who go through phalloplasty and have little to no issues and are happy with their penises and get to live the rest of their life having a penis and having little to no bottom dysphoria and experiencing the gender euphoria that comes from having what they need and having what they want. Yeah, so anyway, any questions, I'm happy to answer. Let me know.